You're watching Fox in the Morning with Mark Bailey, Angela Chi, and Chrissy Russo, the team that knows San Diego.
Was it October of 06? Probably before that.
All right, thanks, Chrissy. More than 80 million Americans suffer from vein disorders. The most common are varicose veins, and while they are unsightly, they can also be very painful, and they can cause some other health problems. Just a few months ago, the FDA approved a new CoolTouch laser treatment. And joining us today is Dr. Margaret O'Byrne from the San Diego Vein Clinic to talk a little bit more about this. Thank you so much for coming in.
I'm happy to be here.
Yeah, now we've all, some of them seen them, and some people will suffer from them, but what exactly are varicose veins, and can it be a major health problem?
Well, they certainly can be a disability, and varicose veins, by definition, are large, bulging veins from the skin, which are weak. So a vein's normal function is to bring blood up from the legs, for example, back into the heart area. But when people suffer from significant varicose vein disease, their veins have a lot of trouble doing that. So they have a lot of backflow in their veins and a lot of pooling of blood in their legs. And that does cause a lot of aching and discomfort and symptoms, as well as, of course, looking unsightly in many cases.
Can it be dangerous if it goes untreated?
Well, there are certain complications of varicose veins which, for the most part, cause disability in the long run, although there are complications such as phlebitis or thrombosis of the veins, which is much more common in patients with varicose veins, and that can be potentially dangerous or even deadly.
I see. And you've been working on laser therapy. You've been involved in different procedures, but now there's a new CoolTouch laser. Tell me about that and how it differs from the treatments in the past.
Well, the laser technology that we're talking about is called endovenous laser. And the reason that this laser has been really a revolutionary technique in the treatment of varicose veins is that this technique very effectively has replaced surgical stripping operations, which was the classic way that these significant varicose veins were treated in the past. And surgical stripping was very effective for many decades. The problem with it, though, is that it caused a tremendous amount of disability immediately after the procedure. And patients oftentimes were really disabled in terms of their activities of daily living for up to 6 weeks. Endovenous laser has basically shortened that into a one-day procedure.
I see.
So the patients are up and around and doing everything they need to do literally within hours.
Great. Well, you have some before and afters. Let's pull up some of those pictures, and you can talk a little bit about this procedure and what they look like, and also now talk about what the patient was suffering from here and then the results. And obviously, are there risks with this surgery?
Well, of course, there are risks with any medical procedure. In this particular case, this woman had significant varicose veins, and they're called truncal varicosities. This patient was treated with a CoolTouch laser and basically had her varicose veins obliterated or almost evaporated, you could say, through the CoolTouch technique.
And how long did the procedure take?
The procedure itself usually takes under 40 minutes to get done. It's done under local anesthesia, so there's no general anesthesia needed. There's really no risk of blood loss or infection or anything like that. This patient, again, had significant varicose veins and had other complications of varicose veins. You can see a little darkening by the patient's ankle. And again, this patient was treated with CoolTouch laser and had a fabulous result.
In 40 minutes, an hour usually is how long the session takes, in the recovery period?
The recovery period there really is no recovery period. Literally, the patients are bandaged, their leg is bandaged after the procedure, they go out for a 45-minute walk, and they really are fine. Most patients will take the afternoon off from work, but they certainly can go back to work the next day.
And no side effects of the laser?
The side effects of the laser include some minor discomfort along where the laser was treated, treating the vein, along the thigh usually. A little bit of a pulling sensation that lasts for a week or so, not enough to cause any kind of inability to do any normal activities, but an awareness. And there can be a little bit of bruising, but really not significant at all with the CoolTouch laser especially.
And how expensive is this process? Obviously more or less than the past procedures, or?
Well, this procedure on the open market in San Diego is usually about $2,000 to $3,000 per leg.
Okay.
There are some situations where insurance is very able to reimburse patients for this type of procedure, and insurance companies by and large have been very receptive to this because they realize it's been a great benefit to patients. And it's been a great advance in medical technology.
Great. Well, thank you so much for coming in. Some very important information out there. If you guys would like more information, you can log on to fox6.com.